Welcome to another episode of Innovista Values. My name is Vic Bakhru. I'm your host and CEO of Innovista Health. I'm joined today by Aimee, our Director of Medicare Performance. She's based out of our Houston office, and I'm excited to have a great conversation today. So Aimee, kick us off. Tell us a little bit about yourself.
Hi. So Vic, I have been with Innovista for now 4.5 years. I have a background in Medicare Advantage and Medicare Shared Savings Program. And here in the Innovista world, we've been able to work with multiple payers. So I was really excited to join the team.
Okay. Well, we're excited that you're here, and I'm so new that being able to understand where everyone sits and how they contribute and support our providers and the members that we serve, the patients we serve, the people that we all serve. Just getting my head wrapped around that, and this is such an exciting time for Innovista. Tell us a little bit about your team. Help our viewers understand where you all focus.
So my team and I, we work throughout the Houston market. We manage multiple ACOs and IPAs, all provider owned. So we work with a lot of different groups. We attend many board meetings throughout the month. We also make sure that we are visiting our provider offices on a monthly basis, providing pertinent reporting to them, assisting them, being their point of communication between their value-based contracts.
Okay, all right, that's helpful. And so for our viewers who may be newer to healthcare, ACOs are accountable care organizations, and IPAs are independent physician or independent practice associations. And so that sounds like a lot. It actually feels like it could take more than a few minutes in the day. Do I have that
yes,
right?
Yes, just the traveling alone definitely takes quite a bit of the time.
Sure.
We work with the providers on different levels. There are certain offices that prefer email, we'll email with them. There are some that we meet with in person. And then there are offices that we meet with after hours, actually, when they're done with clinic.
Okay. And you mentioned you've been, with Innovista for several years now, 4.5, if I heard you correctly. And so you're coming up on that 5-year mark. What are you looking forward to in the next chapter?
Well, I am really looking forward to reducing some of our MLRs that we have, growing our membership, strengthening our team, growing together.
Yeah. And for those viewers, MLR is typically referred to as medical loss ratio. And sometimes at Innovista, we use a variety of different terms to describe this category. So we'll use sometimes a member benefits ratio. Sometimes we'll use a medical health ratio. Sometimes, a few different terminologies can apply. But that's very helpful, Aimee. So thank you. Tell us a little bit more about what you enjoy working with our clients, the providers that we serve.
So the clients that I work with, I've actually worked with quite a few of these in previous roles that I've had prior to joining Innovista. So we've really become like a close-knit family throughout the last several years. So each of my groups really have an independent approach. They have their own ideas of how they want education performed and different initiatives rolled out, sometimes at different times. So we accommodate those, and actually some of my groups now are getting their own direct payer contracts. So that's very exciting for next year.
And how do payers go about that? What's the process like?
So with the different payers we work with, they actually have a few different processes. Most common, you will have to have a minimum number of lives to be able to get your own direct payer agreement. So for some of my larger practices that didn't quite have enough on their own, they decided to join forces with some of their neighboring practices to come together.
Okay, that's helpful. And, I sort of sometimes liken the process to getting folks with different interests into the same boat and rowing together. And so how do you think about it when you're putting together these types of structures or these types of these groups? How do you approach it and get everyone to sort of align around a common goal? I mean, in our case, we always put the person being served at the center of what we do. Is that a part of the journey, or are there other pieces as well?
It is. So many of my boards, one that I'm thinking of, we currently have 8 board members, not all voters, and we really bring different dynamics to the table. So that group was chosen actually by the members that own that group because it was open for investment. So many of the providers participating in that group were also able to purchase shares. So they actually voted for who's on their board. We have a vast background. So we have a cardiologist, and then we also have another board member who's a chief of staff at one of our hospitals in the area. We have some independent providers there. We have some providers focused on telehealth. We also have some large practice providers that maybe now focus more on the administrative role to help educate within their own offices.
So next, Aimee, tell us a little bit about how you think of the opportunity to impact people covered by Medicare, right? That's your area of expertise. It's your area that you focus on mostly across our company, at least. And so I'd love to hear a little bit about what's unique to the members that we serve in that area.
So for our Medicare members, part of what we do is ensure that the patients have access to care quickly. We help work on many of the authorizations that go through from the PCPs to the payer plans. And part of what we do is sometimes we'll get feedback from the PCPs or from the member that they were not able to get an appointment with the specialist, or the specialist is booked out for a few months. So what we'll do is, using those relationships we've been able to cultivate through the years, we will make an outreach to the office and either be able to work the patient in sooner or find another specialist in that area where the patient can be seen in the same week.
Okay. All right. All very important, naturally. What inspires you? What keeps you going? How do you think about, sort of waking up every day and doing this important work?
So actually, I think about my grandparents quite a bit. They're of Medicare age. So every time we're working on a case, I just think of how would I want someone to treat my grandparents' case.
Yeah, no, absolutely right. I mean, we always want the best for our family. And so when you think about and apply that context to your work, I can easily see how, people might go the extra mile, and people might actually, sort of take a special interest if that's the bar, if that's the standard we try to achieve. And we often do it in Innovista. I'm so proud of our team in so many ways for that. So thank you for sharing that. So tell me about being fun at work. I mean, what is it like to work at Innovista? How do you all, sort of show up every day with smiles on? Because I see it. I see the smiles around the office when I'm there, and it's just so heartwarming to see a group of individuals that are at the top of their individual game, but then come together in the group and create awesomeness for the world around us. It's truly inspiring. So tell us a little bit about that.
I mean, we work together closely. We spend time in the field together. So we do get that personal time too, because sometimes we actually drive in cars together, depending on what the day looks like for certain meetings. So fun part of work for me is that we plan a lot of events. So we'll plan outside of board meetings. We'll also plan all PCP meetings. If we have events or meetings around the holiday season, we'll do something fun. For example, one of my boards had a meeting on St. Patrick's Day this year. We just made it casual. We did Raising Cane's, green lemonade. We all had a blast together.
Okay, great. Well, Aimee, this has been an incredible conversation. I continue to be inspired and encouraged by all of the great work that our team does. Thank you for joining today. And to our viewers, thank you for listening to yet another episode of Innovista Values. I'm Vic Bakhru, CEO of Innovista Health. And today I was joined by Aimee Hong, our Director of Medicare Performance. Until next time, take care.